And the next one is case charts. So this is a bit tricky part. So where you need to identify the case. Identification itself is not enough. They'll ask you how you identify. Confirm the identification. So here it is. The first trick for this is you need to know minimum what type of condition it is. So when you're having something like written something like you got a case where it is mentioned about pH, bicarbonates, carbon dioxide. Remember that is related to your acid-base balance disorders. So for example, I'll tell you a trick in acid-base balance. I have already posted a reel for that. The pH normal range is 7.3252 to 7.45. This is the normal range. Below than this is acidosis. Above than this is alkalosis. Now you got it already. By seeing pH itself, you can say that is it acidosis or alkalosis. Now the second phase, you need to confirm is it a metabolic or respiratory. I'll tell you it's very simple thing. So metabolic, body metabolism, which is happening inside the body metabolism. So you will be having bicarbonate, SiO3 minus, and when it called respiration, gases, or carbon dioxide. Remember these two. When it called metabolic, problem with the bicarbonate. When it called respiration, problem with the carbon dioxide. You can ask me, sir, how can I know about this thing? It's easy. pH is directly proportional to your metabolism. That means if you got bicarbonates increased, your pH will get increases. Metabolic alkalosis. pH increased, alkalosis, metabolism increased. That means high bicarbonates can cause metabolic alkalosis. Well, same thing when you're having low metabolism, that means you're having low bicarbonates, you'll be having low pH. That means acidosis, metabolic acidosis. When bicarbonates you are having low, that means it can cause metabolic acidosis. When you're having the same bicarbonates high, it leads for metabolic alkalosis. It's very simple phenomenon. So same thing with your carbon dioxide too. So this carbon dioxide is inversely proportional to your pH. However you want, you can write pH is inversely proportional to carbon dioxide. So how it will work? Simple thing. If your partial pressure of carbon dioxide got increased, your pH will get decreased. Respiratory acidosis. If in case your PCO2 got decreased, your pH will get increases. So that means respiratory alkalosis. It's very simple, easiest phenomena. Just go through with this. First identify whether it's acidosis or alkalosis. Then if you got the find out acidosis or alkalosis, after that, so range of pH increased, check the metabolism. Is it got increased or decreased? If there is no change, go back with the respiration. Is it increased or decreased? If you go on with the metabolism increased, pH increased. So metabolic alkalosis. So pH decreased, metabolism decreased. Metabolic acidosis. So there is no change in the bicarbonate, it's normal. Only change with the carbon dioxide. It's a condition of respiratory. So respiratory, carbon dioxide increase, pH decrease, respiratory acidosis. So CO2 decreased, pH increase, respiratory alkalosis. This is how you're supposed to do that. The compensation mechanism. So if it is respiratory alkalosis, there will be metabolic acidosis. If it is respiratory acidosis, there will be metabolic alkalosis. Cross things. Respiratory acidosis, metabolic alkalosis. Respiratory alkalosis, metabolic acidosis. Same phenomena. You put this side. Same thing. This compensation will be there. There will be full compensation, partial compensation. What happens in partial compensation? pH will be like, for example, in acidosis, pH gone down, but it won't be that normal. It will be down, but up to an extent it will be not too low and all. But that's like a partial compensation. Even in full compensation, it will be lower end. It is 7.35, but it got a carbonic acid condition. So that means it's an acidosis, but the pH is maintaining at the 7.35. So this is called partially compensation. You just have an idea about it. They may ask you what is partial compensation, how it will be partial compensated. So what happens in the partial compensation? Have a look on it. The same phenomena you will be having some disorders like jaundice. When you got jaundice, just go through with the bilirubins. If you got bilirubins in your chart, go through. This is the jaundice thing. In the jaundice thing, you need to identify there are three types of jaundice: hemolytic, hepatic, obstructive. What happens? What is the major difference? Conjugated, unconjugated, both conjugated and unconjugated. So conjugation process occurs in the liver. You need to know this thing. The conjugation process occurs in the liver. Before that, we call it as prehepatic or hemolytic or hemolytic. Before hepatic, we call it as a prehepatic or hemolytic. Post-hepatic, or it can be called as hemolytic, hepatic, and obstructive. So how to identify that? First and foremost, bilirubin is three types. I mean, in three conditions. You can see unconjugated, you can see unconjugated and conjugated, you can see only conjugated in three cases. First, everywhere you're hearing a word called conjugation. The conjugation phenomena occurs in the liver. In the liver, there is a process called conjugation. So before liver, that means prehepatic. If you're having prehepatic, you can have this thing, increase of unconjugated. Increase of unconjugated is prehepatic. Before conjugation itself, it's happening. It might be due to the excess breakdown of your hemoglobin. Excess heme breakdown can cause unconjugated jaundice. So when it comes to the liver, the conjugation phenomena occurs in the liver. So now, post-hepatic, after the conjugation phenomena, if there is a problem in the post-hepatic, that means in the passage, when the passage is going, if the passage got obstructed, what happens? The increase of conjugated only. So you can see that increase of unconjugated, prehepatic, increase of conjugated, hepatic. If you got both the conjugated and unconjugated, both conjugated plus unconjugated, if you're having both, that is hepatic. It's a simple phenomenon. Based on that, you can find out it's very easy. So this is about jaundice for you. So amino acid related disorders. So in these cases, how you're supposed to identify? So there is something like phenylketonuria, alkaptonuria, maple syrup urinary disorder. So like homocystinuria. All these things will be there. For homocystinuria, you can see homocysteine present. So phenylketonuria, alkaptonuria, the color change, diaper color change. These all are the simple tricks for you to identify. MSUD, you can easily say that it's an amino acid related disorder. So the second thing is nucleic acid related disorders. In these nucleic acid disorders, mainly gout. When you see uric acid level, if you got uric acid more than 7.2, remember blindly gout. That's about the nucleic acid. So other than this, you will be having PEM, protein energy malnutrition. So you will be hitting kwashiorkor and marasmus. When you're having the deficiency of protein, when you're having deficiency of carbohydrate, based on the protein deficient, carbohydrate deficient, if you're seeing those things, those are PEM, protein energy malnutrition. In few conditions like organ function test related, so you're having urea ranges of 15 to 40. If you're having more than 40 and all, if you're having creatinine, so more than 1.3 and all. So it indicates that you're having an RFT problem, renal function test problem. So where you're having renal failure, nephrotic syndrome, all these things will come over here. Other than that, you will be having some liver related also. If you're having liver enzymes, SGOT, PT, if you're seeing the OT, PT, all these things, those are liver cirrhosis and all these things you can cover with that. So LFT related things. So if you cover these things, so next. So next, the major one thing is GTT. So there are charts with GTT, glucose tolerance test. So you will be having a chart, XY graph. So there will be 3 points. So fasting point, after giving the sample, you will be given according to body weight, the glucose will be given. So then you're going to take 1 hour sample and 2 hour sample. With that, you're plotting a graph. Based on the graph curve, how it is going, uncontrolled, controlled, like impaired GTT. You will be having 3 types, uncontrolled, controlled, impaired GTT. So based on that, you're going to predict the GTT. So in few cases, you can see that diabetes mellitus directly. So you'll be having abnormal ranges of FBS, PLBS, and you can see diabetic ketoacidosis. You will be having excess amount of sugar and the presence of ketone bodies, all those things. That's called diabetic ketoacidosis. In this pH will be acidic, low pH. So, and then when you go with the, so polyuria, polydipsia, if you're giving those type of symptoms, so those also comes under the diabetes. In few cases, you can see the hypoglycemia too. So where your patient is going to get like dizziness, giddiness, all these things with the glycemia, hypoglycemia. And there is something called in the glucose metabolism, so sugar metabolism, there is something called glycogen storage disorders. So there is a list of glycogen storage disorders. So you just need to go through with that. So each and every type of disorder having their own enzyme also, just go through with them. After that, you will be having like disorders related to vitamin deficiency and mineral deficiency. So if like vitamin deficiency, if you're having something like vision related problem, like the night blindness, ophthalmia, dry eyes and all, those things are vitamin A related problems. If you're having scurvy like symptoms and these things, you will be having vitamin C problems. Like if you can go through with the very things also, like convulsions and all these things. So staple diet and all. So these things you have to go through with that. So when coming to the mineral disorder like as fluorosis and all, they having a dental fluorosis or skeletal fluorosis, abnormality with the teeth, abnormality with the like bones. So there you can go with the mineral deficiency. You need to identify the chart. Once you got like identified the chart, if you don't know the points, you can ask your friends to add on 2 more points, actually 2-3 points. That's more than enough to write to secure a 20 marks of clinical chart. More content, tricks and tips of biochemistry and other subjects of your first year MBBS, just do follow us, subscribe, and you can follow us in the Instagram, ABC Biochemistry, and MedMemes, who supports and content, regular uploads, you can go through with these two. Thank you.